Welcome to Dementia Care and Mental Capacity Training, created by EDS. You will need a notepad and a pen, some concentration and somewhere you can listen well. So dementia. There are different types of dementia. Often it presents in the same way, which if you've ever cared for anyone with dementia, often means it presents entirely differently. That's a confusing statement, but so is providing care for somebody with dementia. So there is dementia Alzheimer's. Typically it affects more women than men, and it usually is onset in older age. Vascular dementia often affects more men than women, and it tends to be an earlier onset because it's predominantly to do with the cardiovascular health, and it can progress really quickly because of that, and you can get onset of it rapidly, much more severe and intermittent than any other form of dementia. Lewy body dementia. This often presents itself alongside Parkinson's. Little plaques break off in the brain and stick to brain tissue, which basically creates dementia pattern behaviour. It can have dramatic fluctuations and can affect the person mainly surrounding behaviour and mood, and it usually is diagnosed with advances in Parkinson's disease. There are other forms of dementia. It can be caused through post-traumatic injuries, Jacob disease, Huntington's, Korsakoff's, Down syndrome have much higher risk of developing dementia, Alzheimer's, Pick's disease. There's many different types, but the point is they affect the individual in the same and totally different way. So dementia presents in any emotion you can put your finger on. So at times the person can experience forgetfulness, they can be agitated, frustrated, they're repetitive, they can be happy, they can be confused, they can be upset, they can be unsure of the cause of their upset, they can be angry, they can wander, they can be relaxed, they can be joyous, they can be excited. They can be any emotion that any of us can experience at any given time. The impact that has on the individual is obviously it's completely confusing. So mood is affected, place in time for that individual is affected, their nutritional and hydrational intake is affected. The person might feel like they've already had breakfast, or they don't like lemonade, so they're not going to drink the drink you've made for them. Personal hygiene can become an issue. They can't remember that they can't wash themselves without prompting, so when it's offered to them, those prompts and that support, they become offended, they become resistant. Medication management, for the same reasons, becomes a challenge. Maintaining a safe home environment. The client can forget that they've turned the hob on. They don't remember why they put the hob on, so they said they don't remember to turn it off. They're vulnerable, additionally vulnerable, and therefore at greater risk of abuse. The client might not remember the stranger danger. They welcome anybody into their home not understanding who they are or why they're there. It prevents people living an easy, straightforward life, and our responsibility as a carer is to try and make that life as straightforward as possible and as enjoyable as possible. Lots of individuals, professional individuals, can contribute to a well-rounded life for somebody with dementia, and we need to be aware of the other people we can involve in that as carers. It often feels like it's just us just helping this one person, and it's not the case. There's tons of people we can bring in to support. One valuable thing to remember about dementia is it doesn't only affect the client, the individual, it affects their family, their close friends, their neighbours. Providing care for somebody with dementia really can be a rainbow of experiences. It affects the individual, obviously themselves, because they don't remember sort of who they are, they don't remember where they are in time, who they've still got close to them, what they do for a living, how they spend their days. Everything can feel such a blur, hence why we get different reactions and different emotions at different times without any obvious reason. They often can trip back to former years, so they remember this time clearly because dementia doesn't affect the long-term memories as much as it does the short-term memories. So you might have a client who is convinced they are at a boarding school and they're waiting for their parents to come and collect them. You'll be looking back at Maud, who is 93 years old, and that clearly isn't actually what's happening, but to Maud it is. And often a lot a lot of the time it helps in our care provision to go along with where that person feels they are, as long as their safety is not compromised. So you as a carer, you need to be a good communicator. It's really important that your communication is effective. That means holding eye contact, be mindful of your body language, be mindful of your tone and the volume of your voice. It gets frustrating when you repeat yourself, but if you repeat yourself louder and more agitated, it doesn't resonate any better. You've got to be your best self in dementia care. You've got to take a deep breath, fix your face, and repeat yourself for the 20th time as if it's the first time you've engaged in this sentence. You need to be a detective in your role. Individuals with dementia don't always remember that they haven't eaten or that they have, so you need to look around for clues to determine truths when you're there to support with tasks. You need to be patient. You have to encourage things gently. You have to cajole, repeat yourself. You've got to support the client with dementia to undertake the task they can themselves within their best interest, and that can take a lot of patience. You need to research, look back through the contact logs. How did somebody manage to get Maud to have a dinner yesterday because today you're struggling? Are there any clues? And be prepared, leave out snacks, drinks that the client can easily access to prior to or post your departure. So if they've not accepted lunch with you, leave a sandwich on the side. Hopefully they'll go back to that when you're gone. And be aware. So it's important to be aware that there is a multitude of supporting assessments, all the referrals we can put in place to gain the support of the other healthcare professionals. It's really important that we maximise anybody's quality of life, and especially those with dementia, as they're not capable of doing that for themselves. Be responsive. Always be responsive in your role as a carer, and communicate any concerns, thoughts, ideas with the office. Anything is always worth bringing to the table. There are lots of myths about dementia. Just because somebody's confused doesn't mean dementia is what's causing that confusion. Dementia is not necessarily a natural part of the ageing process either. It can be triggered by other illnesses, and sadly it can't be cured. Medication can help to improve its symptoms, but it cannot reverse the effects. So when you're providing your care, working with different realities can be great fun, it can be a great stress, it can be a great upset. One form of care provision we promote in dementia care is collusion. So this basically means going along with the person's view of the world as they are seeing it there and then. So we go back to the idea that Maud is still a teenager at boarding school and she doesn't need you to make her a dinner because she's leaving the school today and her mum's coming to collect her. Go along with that. We can still provide our care by going along with Maud's impression. We don't have to argue with Maud that that's not the case. You are there to make her dinner. She's being ridiculous, etc., etc. It can be, oh, okay, well, that's actually tomorrow now, Maud. The collection day has changed for boarding school, so I am serving dinners this evening. What is it you prefer to have for your meal? Go along with it, but you're still ensuring she's getting her meal. This is very useful for achieving short-term goals. It can make you feel compromised as a carer and it doesn't work long-term, but you're there for short periods of time with these clients. It's a very useful tool to use for your short calls. Distraction can really help, bringing somebody back to place and time, or even back to some sort of level, calmer mood. Distractions can be really useful. If a client enjoys music, for example, if somebody's becoming very frustrated, very resistant, suggest putting the radio on. Suggest a client playing you some music. Play them a song that you enjoy, that you've heard recently. Even if you don't think they'll enjoy the music, you're creating that distraction and you're engaging with an interest of theirs, which might help calm them down. It's very, very useful for settling somebody when they're agitated. Sometimes it's necessary, however, to bring that person back to day and time. Often that's when safety is at risk. So if you're going along with somebody's universe, should we say, and that's going to cause compromise, that's when you bring in reality and you reorient the person to now and say, this isn't the case, Maud. This is actually now 2021 and this is what's happening today, and this is the house you now live in, and I am from your care agency. You have to pick and choose what you use and when you use it, and you will find things work with certain clients at certain times, and other times it won't work at all, and that's fine. this isn't always going to work, hence why we have a few different approaches to try and get some situation to always be some form of effective. Validation is good when you really get to know a client. So this means thinking outside the box. So if Maud is insistent that mum is coming to pick her up, this could mean that she's feeling lost or frightened in her adult 93-year-old self. So as you get to know your clients, listen to what they're telling you and try and pick out what you can from their current reality to feed back to the office so we can feed back to the professionals. And it's really, really helpful in working out what emotions they're actually experiencing and why. And obviously, if we get that right, it can be amazing because we can remedy that feeling of panic. What do you do though if your approach isn't working? Simply call for help. If you have tried all these different methods of providing care for this individual and you're not getting anywhere, call for help. Now that's obviously the office or the on-call, depending on the time of your shift. But simply ring and say, you've tried X, Y, and Z and you're not getting anywhere. What advice can you be given from the office or your on-call manager? If the behaviour of the client presents as challenging, threatening or inappropriate, however, you don't need to ring to ask permission to remove yourself from that situation. Remove yourself from that situation and then ring the office or the on-call to explain why you've had to take yourself out of there. Don't ever leave or be in a compromised situation and not communicate that to one of the managing team, please. Always be mindful of keeping yourself safe as well. So the definition of dementia is evidence of a decline in memory and thinking which is of a degree sufficient to impair functioning on daily living, and it has to be present for 6 months or more, accompanied by a decline in emotional control, social behaviour, motivation and functions incorporating a chronic personality change. Translate that basically means somebody has had patterns of behaviour that are consistent with memory issues for over 6 months' time. Now, not many people actually get given a formal diagnosis of dementia these days due to the length of time it requires to actually create that diagnosis. Often people are given a very quick plaster slap diagnosis of assumed dementia or early onset of dementia. That's enough information for us as carers. We can work on that. If we know somebody is experiencing dementia symptoms or signs or early onset or any of the variations, we can manage it. One thing we must be mindful of is mental capacity. So mental capacity means that an individual has the ability to make a decision, and for this to be apparent, they need the ability to be able to understand the information they've been given and remember that information and be able to weigh up that information. What we do as carers and as a care agency is we always assume that somebody does have capacity. Capacity assessments are completed by healthcare professionals when it is required around a specific decision. So if Maud's family felt she wasn't safe at home any longer, there would be a capacity assessment performed on Maud to determine if she does have the capacity to make the decision about whether she chooses to stay in her own home or not. What we have to consider with mental capacity is it permanent or is it temporary? So if somebody is experiencing dementia, then it's highly likely that that capacity issue is going to be permanent. When it's temporary is when we have somebody experiencing substance misuse. So if we go to somebody and they're intoxicated, then their capacity is going to be impaired, but only for the duration of the time that they are intoxicated. That will subside. We need to be mindful of unwise decisions as well. We provide care for such a community of individuals that we need to be very careful that we don't stereotype and we don't assume. Some people may make a decision which to you or I seems completely unwise. To the client, it might make perfect sense. We need to be mindful that we don't mix up the two. So there's a difference of Maud making a decision that we wouldn't agree with, so we feel it's unwise, and Maud making a decision which is a very bad decision, and that's based on the fact she doesn't understand the decision she's making. So there's two very, very different things here. So an example of unwise decision making may be this. Harry has leukemia. He's been offered treatment which would significantly increase his life expectancy, but he's refused. He's 23 years old. The treatment is a blood transfusion. Harry is a Jehovah's Witness. So the decision to Harry to not accept that blood transfusion makes perfect sense to him, and there would never be another option. He accepts his diagnosis and accepts that's the path he chooses. To you or I, that may seem completely ridiculous because Harry's life could be saved. He's only 23. But that is just an example of what may seem an unwise decision to us. It doesn't mean that Harry hasn't got capacity. He has capacity. He understands that decision that he's making. There needs to be considerations around other barriers that may be present. So communication barriers. Does the person we're talking to actually understand what they're even being asked or the information they're even being offered? Are we talking in the language that they understand? Can they hear us properly? Can they talk properly to question us and seek more information from what we're saying? And are there organic causes? So by that, what I mean is a urinary tract infection, a UTI can make somebody more confused. It doesn't mean that all of a sudden their dementia has dramatically accelerated in process. It can mean that actually there's just another little problem going on here which we can remedy. We need to be very mindful as carers and a care provider to make sure that we are looking at the person as a whole to ensure that they are getting the maximum out of their quality of life, and we're promoting them to do that. And this brings us to best interest. So best interest means to act in an individual's best interest by ensuring that any action or outcome is conducted within that best interest and in the least restrictive way possible. So an example could be that Maud wants to wear her favourite summer dress, but today is a really cold day in November. To act in her best interest and without restricting her own choice, you could as a carer encourage her to wear a cardigan, a jumper or a shawl on top of that summer dress. If Maud is not going to accept this addition, then leave warm items sensibly and safely around the house. For example, a cardigan on the back of the chair, a coat on the back of the door. So if she chooses to go out, she may be prompted to put on this coat. And of course, document this in your notes and let the office know that you've had a concern. Because if Maud is wearing a summer dress on a frosty day in November, it's not appropriate clothing. We need to be mindful that we're not depriving anybody of their liberty. So this basically means their independence. It's tricky on community because it's not something we experience over much, but there is a Dolls Act, which is deprivation of liberty, which may mean that we restrict somebody to the point where they can't leave a residential home, for example. A residential home may lock their front door. Somebody may argue that the residents in that home therefore don't have the freedom to leave. They're locked in. They don't have choice. They don't have independence. The residential home may argue that it's based on a main road and to promote the safety of other residents, that door needs to be locked. Where it's relevant to us in domiciliary care is often we have clients who have their medication kept in a locked box. Now that's because they need full support with their medication to ensure they can take it safely and keep well. One might argue that is a deprivation of their liberty. They don't have free access to the medication. So we always have to risk assess and fairly assess that that is a safe choice made in that client's best interest. When you're providing your care for somebody with dementia, there are all these different spiderwebs, firework angles to always consider, and it can feel complex and it can feel overwhelming. What we encourage you to do is simply provide non-judgmental care. Always assume that capacity is present, always act in the client's best interest, always seek implied consent in all your provisions. An example of this would be, I'm going to make you breakfast now. Rather than asking if they want breakfast, if you know that's going to be declined, you're telling them you're doing that. You're seeking implied consent. Always empower the individual and support them to make any choices that they can of their own. Always involve other healthcare professionals and never restrict the client unless it's in their best interest to do so. An example of that could be, you need to stop Maud crossing the busy road because she's really eager to get to the side, but she's not looking for traffic. That's when you would restrict Maud. That's when you would try and bring her back to this place in day and time and point out the traffic. If ever you are at a sticking point with your care provision with dementia, please just ring and ask, because we appreciate how difficult it can be. We've all been there. And remember, Maud, in this scenario, is still Maud. Your clients are still themselves. Always remember that. And you'll carry out your care for dementia clients perfectly.